Hello, this is Unit 5 Journal. This is my experience regarding a 23-year-old female patient who presented to crisis on a voluntary status expressing suicidal thoughts. She does have a principal diagnosis of major depressive disorder and generalized anxiety disorder. She does have a significant psychiatric history in terms of medication use and psychiatric treatments. When I assessed her inpatient, she had been inpatient for about 24 hours and she was doing well. There were no acute events. She did complain that she would prefer to have Strattera instead of Adderall. She was on Adderall due to her ADHD. And the fact that it was keeping her awake at night. So we did switch her to Strattera as per patient's request. She did say that her intrusive thoughts of suicidal ideation are very much diminished today and she's less anxious. She's also been, she was attending group therapy, and she was very much attentive and participating in those group therapies. Patient was currently on Pristiq, which we wanted to decrease because Pristiq and also has a stimulating effect, and she was also on Strattera. Also, we were going to decrease Ativan to 0.5 milligrams because we wanted to discontinue the use of benzodiazepines. We were planning to continue her on Viibryd, vilazodone, antipsychotic, and we will be titrating it to 20 milligrams. She's currently on 10 milligrams and will be titrating it to 20 milligrams. The goal is 20 milligram daily. That's the goal of the dosage. Her EKG was normal sinus and the QTC was 380 milliseconds, which is within the range of normal QTC for women. Her urine drug screen was negative, so there was no drugs found in her urine, which could probably have indicated the heightened activity or stimulant activity that she was experiencing. So overall, the patient was alert and oriented. She was pleasant. She defined her mood to be fine. She did say that her thought process was linear and goal-directed, and currently she was not having suicidal ideations. She did have a good insight into what was her issues in terms of MDD and GAD, and her judgment was fair. She was willing to go through therapy and get well soon, so she did have a positive outlook to life.